The first rule of toxicology is get the patient away from the toxin or the toxin away from the patient. Of course, in the internet, everybody has an opinion. Everybody thinks you should do this or that or the other. I'm based in medical science and medical evidence. When I went to medical school, I was said, in God we trust. Everybody else has to show data.
Dr. Andrew Campbell is a professor in toxicology and immunology and the world-leading expert in mold and mycotoxin-related illnesses. Dr. Campbell, is a huge honor to have you with us today. My first question to you is, when do you strongly suspect complications that are related to mold exposure?
Mold has to be in an indoor environment, a home, somewhere where you work, somewhere indoors. And if there's a leak, a water leak, it could be in the bathroom, it could be in the kitchen, it could be behind the dish washer or the clothes washer or somewhere where there's a leak. It could be the roof, etc. Rain gets in, mold starts growing. So when do you know? Is you start feeling bad. The first symptom is fatigue, brain fog. These are the two main first symptoms.
How much mold exposure in terms of duration is enough to lead to a negative health outcome?
Molds are like a plant. You have seeds, you have a pot, you put some soil in the pot, you put the seeds, you give it some water, and after some time, something grows out. And this makes seeds also. In molds, you get them wet. Instead of seeds, they make spores, and the spores carry a mycotoxin with them. What does that mean? Spores, human hair is 100 microns thick. Spores are 2 to 4 microns. They're tiny. So you don't feel them, you don't see them, and you inhale them and they get into you. And because they're so small, they go directly into the blood. The first place they attack is always the brain. Second, the mycotoxins are 0.1 microns, meaning the same size as a COVID virus. And there's no filter, nothing you can do about that. Again, you don't see it. And so when you are in an indoor environment and there's mold growing somewhere, it doesn't matter the quantity, because a toxin is a molecule. It's not a living thing. And that toxin in the mycotoxins for mold that the spores carry are carcinogenic. They're toxic to the liver, toxic to the brain, toxic to the kidneys, toxic to skin. You don't want any amount, zero. It's like saying, how much mercury is it okay to have in the body? Zero.
In terms of duration, after getting exposed to mold to get a negative health outcome, does it
Yes.
take days, hours, months? Is it very easy to get complications from mold exposure with short duration?
Yes, it's like any toxin. And since toxins are molecules, they go anywhere they want in the body. So in as far as mold toxins, toxic molds that make these toxins, these will go, and every time you breathe, you're breathing in these. Now, the big question is, and the hardest question of all of this is, how do you find it? Sometimes in 50% or more, you don't see it. It's underneath tiles. It's behind a tile. It's behind a wall. It's inside walls. It's not visible. Sometimes it is. Sometimes people tell me that I see a black or green patch on my wall.
Mm.
And then you don't paint over it. You have to completely remove it. And then repair, and then you're fine. Sometimes, because again, these are toxins. So even though you got rid of the cause out in the home or where you work or whatever, these toxins remain in you unless they are removed medically. And what I mean is not surgically, medically, with medication and certain things you have to do to get rid of them.
To my knowledge, there is no testing here for mold. What do you recommend for people who are living in the Middle East and who believe that they have mold complications that are related to mold exposure?
Depending on the country you live in, there are methods for testing. For example, in Canada, it's not known. In the United States, it is, and they have companies who come to your home, to wherever you want them to, and they come and they test for mold. Okay, so Canada, no. United States, yes. Mexico, no. They don't know. They don't have this. So it depends in which country you are.
Mm-hmm.
Believe it or not, China has it.
Mm-hmm.
Japan has it. China has everything.
Yes.
Anyway, so it depends again where you live. Some countries have it and some don't. There is a person here in the United States by the name of Brantley May, who's a building engineer. And he's probably the smartest person who can explain this to a person on the phone or in a Zoom. And he's young, and well, to me, everybody's young, of course, but he's a young man and very, very intelligent. I've spoken to him many times, and he is able to really help people all over the world through Zoom or telephones. So he would be a person you call or send an email and then make arrangements to speak with Mr. Brantley May. Once you find it, it's easy to get somebody come and get rid of it
Get
and
rid of
clean
it.
it. But finding it is not easy.
Yeah.
And this is why this Brantley May building engineer can tell you where to look and how to find it. Then the second is the treatment, because there's, of course, in the internet, everybody has an opinion. Everybody thinks you should do this or that or the other. I'm based in medical science and medical evidence. When I went to medical school, I was said, "In God we trust." Everybody else has to show data. So I want to see the data. If you say something that use this really is good, or do this, okay, show me the data.
I understand that you have a lecture for us today. You can share it with us, please.
Of course. So the first place mycotoxins attack, as I said before, is the brain. Same with mercury. And then the gut, the gastrointestinal system. And then I'm going to discuss about things that are either correct or incorrect. Just a little, what does it mean, evidence-based? It means evidence-based medicine is the best medical and scientific evidence combined with the doctor's clinical experience. My experience is 35 years. I've published over 100 studies in medical journals. I've lectured at Oxford University and Harvard Medical School, and I was on the faculty at University of Texas and Medical School in Houston. Here's some of the things that do. I'm actually a fellow of the Royal Society of Medicine. I'm the editor-in-chief for 5 medical journals, etc. Just my credentials. And here's something 2 people said: wrong does not cease to be wrong because the majority believe in it. And we can see that in the media today. And if you have knowledge, let others light their candles with it. And that's what I like to do. I like to teach others from my experience. How do you treat things that are from toxins? You first find the cause, remove the cause, and then repair the damage, and the person is healed. They are well again, they're back to normal. And this includes in children, autism, and young men and women, multiple sclerosis, and older people, Alzheimer's, Parkinson's disease, amyotrophic lateral sclerosis. There's many, 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 any autoimmune disease can be cured. And I will show pictures rather than just talk. So this is a brief.
In 160 seconds, you will decide how this story ends. This is a story about us, the indoor generation. A generation that spends 90% of its life indoors. It all started the day we left nature behind. We filled our homes with lovely things and all the stuff we wanted. Our homes became places you would never want to leave. Artificial light replaced daylight, and we built our houses so that nothing could escape. We cooked and showered and played, slept and sweated. But we had closed ourselves in to a point where nothing could get out. So when the air turned bad inside, we tried fixing it with chemicals. And we put in little artificial suns everywhere. That's when things started to happen. Hard to notice in the beginning. Some needed help to sleep, to breathe, to not itch. Many of us even started to feel sad. So we turned on happy lamps to make the sadness go away. Then, scientists discovered that the air inside our homes is up to 5 times more polluted than the air outside, and that the lack of daylight can affect children's learning and increase blood pressure. It turns out that kids' rooms often have the highest concentration of toxicants in the house. In fact, millions of homes are unhealthy to live in. They discovered that living in damp and moldy homes increases the risk of asthma by 40%. And I learned that millions of people like me suffer from asthma and allergies caused by a bad indoor environment. And so, here we are. How the story ends is up to you because it's not written yet. If you care about the indoor generation, do something. Begin to think and live differently. Let light and fresh air into your life again. Even small changes can make a huge difference for coming generations. Learn how at theindoorgeneration.com.
This was filmed in Holland. So let's talk about medical evidence and the facts. Here's what was published 89 and 1987. So this is not new. Spores of toxigenic fungi contain mycotoxins. Mycotoxins associated with spores are likely to be absorbed through the breathing respiratory epithelium, and then they translocate to other sites in the body, producing systemic effects. So molds produce toxins known as mycotoxins. Molds are always present in homes or workplaces that are water damaged, and they're constantly producing mycotoxins. Mycotoxin exposure is far more common than expected. In the United States, 85% of buildings have had previous water damage, while 43 have current water damage. Here is an example of testing of air conditioning system and 3 columns, each one with a different mycotoxin. So each part of the air conditioning system was tested. That's the column all the way on the left. And you can see there's no aflatoxin because aflatoxin does not grow indoors. There is some ochratoxin, another mycotoxin, but there's a lot of trichothecenes, and trichothecenes, the last column on the right, are the most toxic substances made by molds. 2 important points: a mold that produces some mycotoxins, they produce a series. They don't produce one mycotoxin. They make many mycotoxins. And then on top of that, So one mold makes many mycotoxins, and if a mold is known to produce a mycotoxin, is present in a home or building, then the mycotoxins it makes are there as well. This is what I mentioned earlier. Hair is 100 microns thick, human hair. Spores are 2 to 4 microns, and mycotoxins are 0.1 microns. And it's mainly by inhalation that you get these toxins or through the skin. Swallowing is minimal, so it's mainly through absorption of the skin and through breathing them. So where do they go? The brain. The overwhelming medical and scientific evidence shows that it is in the brain and nervous tissues that are affected first. This includes not only the brain, but the nervous tissues in your arms, in your body, and in your legs. And so what happens is your body makes antibodies to these, your immune system makes antibodies to these mycotoxins, and these bind to human tissue. They attach themselves to human tissue, including tissue of the brain and nervous system like myelin, and it triggers demyelination. And that's one of the principal causes of multiple sclerosis, chronic inflammatory demyelinating polyneuropathy, and several other illnesses. So once we know that the brain is first, let's take a look at the brain. It's the only organ almost completely surrounded and protected by bone. Not the heart, not the liver, not the kidneys, only the brain. It weighs 3 pounds, a little under 1.5 kilos, or about 2% of our body weight, but it uses 20 to 30% of the calories we use. And from the carotid arteries and the vertebral arteries, it receives the most highly oxygenated blood coming out of the heart. And that's very important that it gets the freshest oxygenated blood. The brain uses 20% of the oxygen absorbed by the lungs. The hourly blood flow through the brain is 13 gallons. That's about 52 liters every hour, or 20% of all the blood pumped through the heart goes to the brain. And we have 400 miles of blood vessels, around 600 kilometers of blood vessels in the brain, mostly capillaries. They're about like a hair, a thickness of a hair, because we have 100 billion nerve cells, and each one needs oxygen and needs nutrients, and that comes through the blood. Every person's thoughts, memories, emotions, actions, and reactions are in the brain. So what are the brain neurological effects of mycotoxins? Autism. You have decrease in short and long-term memory in adults and children. You can get optic neuritis, which gives blurred vision, poor vision, etc. Chronic inflammatory demyelinating polyneuropathy. This is where you have a lot of numbness and tingling in your arms and your legs and in your hands. You have imbalance, you lose your balance and various other things. Guillain-Barré syndrome is mainly in the legs. They become numb and it makes it walking difficult. ALS is amyotrophic lateral sclerosis. Alzheimer's disease, multiple sclerosis, movement disorders, and Parkinson's disease. They did a study. Well, I'll show that in a little bit. This was a study that's taking the first one, autistic child, a study of 172 children with autism and 61 controls. 61 were normal, 172 had autism. The authors of this study, and it's referenced at the bottom, the authors showed significant difference in comparing antibodies to mycotoxins between the two groups, showing that the autistic children had elevated antibodies to mycotoxins, but not the 61 controls. So the authors, all people at Tufts University School of Medicine in Boston, continued these studies, and they implicate that about 70% of cases of autism are due to mycotoxins, and the best way to measure it is by measuring it in blood serum by antibodies. Here's two boys. On the left is 1 year after I treated them. They're 6 years old in these pictures. There were 5 when the parents brought these two twins to me, and they couldn't, no school would accept them. Now they had been accepted, and they came to tell me at my office. The picture on the right is when they were accepted in the university to study industrial engineering. Of course, it's many years later. You can tell by the color of my hair, but I wore the same color shirt. I wish I could do that with my hair too, but I can't. Okay, so here's a study published in this journal on the dysregulation of the autonomous nervous system in patients who have mold. So, chronic fatigue syndrome, fibromyalgia, hypersensitivities like allergies, food intolerance, sensitivity to chemicals at concentrations that most people feel fine. You and me, we feel fine, but these people get very, very ill from it and feel terrible. Sensitivity to electromagnetic fields, all can be associated with mycotoxins. Some of the symptoms experienced by patients with advanced mold-related disease, such as fatigue, memory and cognitive, they can't think well, and somnolence, they're sleepy, they're tired, are the same ones reported by women who have silicone breast implants. Neurological, this is from the same study, neurological manifestations in patients with postural orthostatic tachycardia syndrome, POTS, myalgic encephalitis, chronic fatigue syndrome, chronic regional pain syndrome. All these are conditions that may be associated with advanced mold-related illness. So as you can see, it's pretty vast. And here are 3 studies, and these 3 showed that they demonstrated the mycotoxin called gliotoxin causes demyelination, leading to multiple sclerosis. Rutgers Medical School in New Jersey in the United States published a study in 210 that stated, "We propose here that fungal toxins are the underlying cause of multiple sclerosis and thus may offer an avenue towards an effective cure." I can confirm that. I have treated many young people in their 20s, 30s, 40s who had developed multiple sclerosis. They came to me in wheelchairs, and 8 months later, 10 months later, they were playing soccer. They were fine. So the same gliotoxin has been shown to affect and damage brain cells called microglia, brain cells called astrocytes, and brain cells called oligodendrocytes. Oligodendrocytes make myelin. The brain is considered gray matter and white matter. White matter is myelin, and gliotoxin destroys myelin. It is a mycotoxin that is a neurotoxin. It's toxic to the brain. And if you cannot use glutathione in patients with gliotoxin because it'll make the gliotoxin more toxic and they'll get worse. And this was published in a study 4 years ago. The other one, another mycotoxin, it's called deoxynivalenol, disrupts the central nervous network, including the neuroendocrine, the part that controls hormones, and also growth hormone signaling. Children stay smaller than their other children. Notably, the contamination of molds and mycotoxins has been identified in the brain of Alzheimer's disease patients. Moreover, DON, which is deoxynivalenol, can significantly affect the normal activities of the nervous system and the endocrine system, hormones, then cause damage to brain cells. Another mycotoxin, known as T2 toxin, changes the cellular structure and function in the brain. That was described in this study that's referenced. Here's a study where they took Alzheimer patients that had died, took them to pathology, opened the brain up, and what they found was every part of the brain, including the cerebrospinal fluid, had mold. So let's take another look. And this woman is the wife of a dentist. She asked her eyes not to be covered because she wanted to show everybody how she looked on the left in October 2024, and on the right, it's April 2025, 6 months later, with treatment for mycotoxins and toxic molds. She's back to normal, no more Alzheimer. So this is a study about how to monitor mycotoxins in plasma when patients who have Parkinson's and Alzheimer. They took 14, they took patients, diagnosed 44 patients with Parkinson's and 24 patients with Alzheimer, and take the blood from either, if it's the wife or the husband of the patient who had Alzheimer, and analyze them for antibodies to mycotoxins. Well, they found all of them had these three mycotoxins, ochratoxins, sargamatocystin, and deoxynivalenol. Then this study, looking at glutathione, which is an antioxidant, provides evidence that glutathione is associated with the pathophysiology of Parkinson's disease. So I think it's okay to give people who are in their 20s, 30s, and 40s glutathione, but anyone in their 50s, 60s, and beyond should not receive glutathione because it puts them at risk for developing Parkinson's disease. Here's T2 toxin again, and it's able to cross the blood-brain barrier and accumulate in the brain. And remember that gliotoxin toxicity increases in the presence of glutathione. This is a study of 119 patients. 79 were female, 40 were male, and 20 were control, meaning they were normal. Data obtained from nerve conduction velocity studies for motor nerves and sensory nerves. And we know in medicine that you can have motor nerves, which tell your muscles to move. You have sensory nerves, which are your senses, touch, feel, et cetera, et cetera. And then you have mixed. They have both. So patients with abnormal findings comprise of three groups. The mixed sensory and motor, there were 55. So a little less than half. Those with motor, in other words, the nerves that control movement, there were 17. Sensory were 27. Well, this was the study published. It's actually a chapter in a medical textbook. I'm one of the authors. How about amyotrophic lateral sclerosis? This study showed, again, in patients who had died at autopsy, that there was mold in the brain, even in the cerebrospinal fluid in patients with amyotrophic lateral sclerosis. What can patients get misdiagnosed by doctors who truly have a mold mycotoxin problem, but they get misdiagnosed into fibromyalgia, chronic fatigue syndrome, chronic Lyme disease, anxiety, depression, resistant to treatment, to medications, autism, PANDAS, PANS, autoimmune disorders, dysautonomia, POTS, and breast implant illness. So this is a study by Dr. Tuominen that was published a few years ago showing that postural tachycardia syndrome, POTS, myalgic encephalomyelitis, chronic fatigue syndrome, autoimmune disorders, and dysautonomia are all linked to mycotoxins. Here is a study I published in the journal Autoimmune Diseases showing how autoimmunity affects the gut and how that can come from mycotoxins. This is inflammatory bowel disease. What is inflammatory bowel disease? Well, SIBO, Crohn's disease, irritable bowel syndrome, ulcerative colitis. Strong evidence is provided by well-designed studies showing that the mycotoxins, deoxynivalenol, has the potential to induce the onset of inflammatory bowel disease and ulcerative colitis. So this is follow-up on the studies I showed you a couple of slides back. Mycotoxins change the function of not only the central nervous system, the brain, and the peripheral nervous system, which is in the arms and legs, but also the glands of internal secretion, our hormones, especially the thyroid. Mycotoxins can cause development of autoimmune thyroid disease and type 1 diabetes. Autoimmune thyroiditis is also known as Hashimoto's disease. And this is Hashimoto's thyroiditis. Millions of people struggle with this disease, an autoimmune thyroid disease. They eat normal amounts of food, exercise regularly, but they keep continuing to gain weight. Their thyroid levels with thyroid replacement therapy is difficult to treat. They up, down, up, down. This is because the cause is the mycotoxins, not the thyroid. So the key here, once you treat the mycotoxins, the Hashimoto's goes away. So this is where you come back to identify the cause, remove the cause, treat the damage, and you're fine. Rheumatoid arthritis, which affects a lot of people. Well, in this case, deoxynivalenol, these are two mycotoxins, deoxynivalenol, ochratoxin, increased the susceptibility to develop rheumatoid arthritis, made you more likely to get it. They also, for patients who already had rheumatoid arthritis, they made it worse. And they elevated these two cytokines, interleukin 1 beta and interleukin 6, and these were found in inflamed joints. So, as you can see in his ring finger, he has rheumatoid arthritis, and if you look at his skin, he has psoriasis, and this is known as psoriatic arthritis. This is the same person. This is his chest and abdomen, and you can see the finger with rheumatoid arthritis 6 months later with the right treatment. Here is a woman. She's the mother of a famous doctor. He asked me if I can help his mother. I said, of course. And this is the picture before and after. You can see on the left what her legs look like, and now on the right, they're normal. His mom is now fine. What about silicone breast implants, which are more popular in some countries than others? They were first marketed in 1962. And then recently, there's a development of a particular kind of cancer known as anaplastic large cell lymphoma. And now it's been shown that it's proved by but it's caused by silicone breast implants. What are the symptoms? Brain fog, hair loss, fatigue, chest pain, sleep disturbance, irritable bowel syndrome, headaches, chronic pain all over the body, and autoimmune diseases such as lupus and fibromyalgia. So this author, Dr. Ditchman and his associates, published this paper, and he cited one of the ones that Dr. Brautbar and I published in 1995, 30 years ago, and proposed that there was evidence for causal relationship between implants and disease. What many people don't know is that these implants, they sweat, they release silicone particles, and these particles end up inside the capsule or migrate to other tissues inside the body. In other words, if you take a box with implants, silicone implants, and put them on a piece of paper, and half an hour take them and put them back in the box, that piece of paper will have an oily circle from the silicone. So silicone implants are basically the color of ice. They're, blue color, whitish blue. This does not look whitish blue. This is a 74-year-old female presenting with bilateral breast pain. She underwent capsulectomy, meaning the scar tissue that covered the implant, and that piece is on the right. And you can see that it's discolored. This is saline implant. Both of them, you can see that they're abnormal in color at the top, with the left and the right. So, what do you find in these implants? All those things that you see in there are molds. So, and they did a study on 200 women with breast implants. Positive cultures were found in almost 70%. It was toxic molds. Let's take a look at chronic sinus problems, where you're always having sinus, you're blowing your nose, your nose drips, etc. Dr. Ponikow, chairman of the ear, nose, and throat department at the Mayo Clinic, published this study in 1999. He took 210 patients who had chronic sinus problems, took them to the operating room, took everything in their sinuses out, sent this to the laboratory, and said, find for me, what is the most common cause? The laboratory reported back 96% had mold. What's the treatment? Intranasal amphotericin B is a nasal spray, reduce the inflammatory mucosal thickening on both CT scan and nasal endoscopy. Here's a big study on 35 different types of cancer where molds were found in all of them. This is a study, multi-center study from the United States, 17,401 patients. They had tissue, blood, and serum. And these people had 35 different types of cancer: cancer of the brain, cancer of the bone, lungs, etc., etc. Fungi molds were found in individual tumor types and contributed to the carcinogenesis of esophageal cancer, pancreatic, breast, lung, melanoma, ovary, colon, brain, and bone. So here is the forehead on the two left pictures of a man who has a huge cancer on his forehead. 59 days of treatment, with itraconazole, which is an antifungal, and you can see that in a day less than 2 months, what happened to the cancer? You killed the fungus that causes the cancer. Well, what about a family where the woman becomes pregnant and this baby is developing? Well, mycotoxins can cross the placenta into the fetus, especially deoxynivalenol and ochratoxin, causing miscarriage, stillbirth, prematurity, small babies, and stunted babies. Mycotoxins were found in 73% of amniotic fluid samples from fetuses with genetic defects. Again, you have 35% higher probability of stillbirths if you're exposed to mold and their mycotoxins, and there's a higher number of premature births and late miscarriages. This is just 2 years ago. Every study, as mentioned, is referenced at the bottom of the page. Mycotoxins are also complicit in the manifestation of conditions such as polycystic ovary syndrome, premature ovarian function, and endometriosis, which can cause serious problems in conception and maintaining a pregnancy. And in the same study, what it does, it alters testosterone in men and reduces the efficiency of spermatogenesis, the making of sperm. It reduces sperm motility, how long they live, and the response, but also the ability of a mycotoxin known as zearalenone to bind to receptors on the male reproductive cells. So essentially, in men, it can cause very low testosterone, almost sterility, because of abnormalities that it causes in the male reproductive system. This is a study moving on to Lyme. This is a study I did. So how do you differentiate between Lyme and mycotoxins? Because the symptoms are very, very similar. Unfortunately, there's a lot of laboratories who claim to do Lyme studies, but they're not acceptable or not suitable. So the type of Lyme tests that are not suitable for the diagnosis of Lyme are these: the antigen detection in bodily fluids, the PCR testing, lymphocyte transformation, the ELISpot, etc. And here's the second one, the VCS, the measurement of patients' ability to recognize different shades of gray, the so-called L-forms, the detection of immune complexes, the CD57, and the rapid test. It's very, very low sensitivity. So the other part is antibodies to Lyme. The Borrelia bacteria can persist for several years despite a clinically healed infection from these insects that can cause Lyme. Let's talk about the gut. The gut has 4 layers. There's the first one. It has 3 barrier functions. The anatomical and histological layers, 4. There's 3 cell types, and there's 3 layers of protection. Let's take a look, because throughout all our lives, starting with birth, we put things in our mouth, liquid and food, and this has to go through the gut. So the gut is constantly exposed every day to all kinds of things that we eat. Other point of everything that we eat is that we have to have a healthy microbiome because 80% of the immune system is in the gut. So let's see. The first layer is the intestinal epithelial layer, and it's the first defense barrier to mycotoxins. And the barrier depends on what kind of microbiome do you have, the cells, the epithelial cells themselves, and the immune cells in the lamina propria of the gut. The epithelial cells are connected one to the other through desmosomes, adherens junctions, and tight junctions. This was developed by Dr. Alessio Fasano, who found this out years ago and has published many, many studies on this area. So let's look at the 4 anatomic and histologic layers. Number 1 is the mucosa. Number 2 is the submucosa. The third is the muscularis propria, and the fourth is the muscularis mucosa. 80% is the epithelial cells, 3 major cells. The second important major cell types are the mucin producing goblet cells, mucus. Third is the Paneth cells, which produce antimicrobial peptides, AMPs, in the crypts to kill bad bacteria. And the epithelial cells, as I said before, are connected by desmosomes, adherens junctions, tight junctions, and these form a mechanical bond or barrier, physical barrier, keeps them out. This barrier blocks the entry of large particles and, of course, pathogens, bacteria and viruses, etc. It's permeable to water, electrolytes, and dietary nutrients. Next is a chemical barrier, and that's made up of mucus, the antimicrobial peptides, and cytokines secreted by the epithelial cells. And the third barrier is the immunological one, and it consists of the lamina propria, which contains capillary and gut-associated lymphoid tissue, that's major part of the immune system, that are made of immune cells, macrophages, dendritic cells, and lymphoid cells. On top of that, secreted immunoglobulin A is secreted, and cytokines are produced by the immune system to complete this protective barrier in the gut. Therefore, the totality of the 3 interlaced symptoms, the first is the microbiome. The second is the physical and the chemical barrier, and the third is the immune barrier. All these 3 work in conjunction to keep us all healthy. And just as a note, my mother died when she was 103. On her 103rd birthday, she said we filmed her saying things in the 8 languages she spoke. She spoke Arabic, she spoke Farsi, she spoke Turkish, she spoke English, French, etc. And a few weeks later, she passed. Every time I took her to a doctor, starting at age 95, they said, "How are you not taking any medicine?" She said, "Because I ate the right foods." Of course, what was the foods she ate? It was Turkish food, Persian food, and Arabic food. Very healthy and very good. Makes you live a long time, and long time healthy. So there are more nerve cells in the gut than in the spinal cord. And the microbiome is continually and persistently exposed throughout life to foods, liquids, and chemicals. The gut microbiome consists of all the microorganisms in the gastrointestinal tract. These include bacteria, viruses, fungi, and protozoa. And those are the main phyla of bacteria. And the function of the microbiome includes the synthesis of vitamins, enzymes, amino acids, the absorption of minerals and nutrients, the breakdown of large molecules, and the production of short-chain fatty acids. The human human beings are made up of 35 trillion cells. That's 35 plus 12 zeros. The microbiome in the gut has 135 trillion cells, microorganisms. So that's 100 billion more. We're made up of 23,000 genes, the microbiome 8 million. So it has the ability to transform the toxicity of mycotoxins by several different mechanisms, most of which change and modify the toxicokinetics of mycotoxins and thereby lowers their toxicity. So the gut plays an important part in helping detoxify if anything is swallowed with mycotoxins. Two basic mechanisms are involved. One is the change to the structure of the mycotoxins by biotransformation, and the other is by changing the absorption of these mycotoxins. And the most common is chemical transformation by enzymes. And this reduces the toxicity of mycotoxins. Another effect of the microbiome and mycotoxins is the ability of components of microbes, mainly from the cell wall, to form adduct chain or bind to the mycotoxins, and so they can't get absorbed. And these are ceftriaxone, T2 toxin, and others. And all of these help in the gut to keep mycotoxins from affecting that human being. So again, going back, it's mainly through inhalation and skin that we get mycotoxins, not the gut. And because of the serious concerns for animal and human health, regulatory guidelines for the levels of deoxynivalenol in foods and feed are enforced in more than 40 countries. So we don't have to worry about that. All these countries make sure we don't have that in our food. Let's take a look at Fusarium mold, which makes vomitoxin. Well, Fusarium can make a lot of different mycotoxins in large amounts. And since it's widespread in contaminated indoor environment, it gets to your lungs commonly. So, and also they can adhere to foreign materials such as indwelling catheters, artificial heart valves, joint replacement, and they grow on these things. But the risk of acute intoxication in humans is low in developed countries, where the amount of mycotoxins in food is controlled by the authorities. What they look at for food is what is called the tolerable daily intake. All these organizations make sure that it's below 10 parts per billion. So people will say to me, what's 10 part per billion? I ask a scientist because I'm a visual. I want to see what that looks like. He says, take 1,000 soccer fields, cover them all with ping pong balls. Take one ping pong ball, that's 1 part per billion. So that's an easy visual. Well, there's mycotoxins in milk. 91% of milk has mycotoxins. But because it's less than 10 parts per billion, it doesn't matter. It's not going to affect us. We're going to get rid of that very quickly. So it's really not a concern about food. And I wanted to bring that up in this presentation because a lot of people think it's from food. Yes, in certain countries, especially sub-Saharan Africa and also Western China, it's a problem. But in other countries, mainly it's not. And here's what is said. One has to admit that today, the risk of acute intoxication is very low. And this is a study showed that a man weighing 170 pounds, about 80 kilos, would have to consume 7 kilos of oatmeal at one sitting or 20 slices of bread at one time that is moldy in order to be effective. Well, obviously, no one's going to do that. So you have low levels of mycotoxins in many foods. But again, they're not going to affect us, and we're going to excrete it in urine and feces. This study showed, was published 3 years ago, that the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. That lab is called microbiome. I'm sorry, it's called mymycolab.com. Anyway, this is the urine test saying it's no good because it's affected by age, diet, whether you're male or female, how much muscle mass you have. And you'd have to do it several times throughout the day. This is my mycolab, so it's the most precise and accurate test for mycotoxins. Kidneys. Albumin is the most abundant protein, plasma protein in the body. And albumin will bind to ochratoxin with 99.8% affinity. So you can't excrete it, but you always find it in urine by the urine labs. How can it be if it can't be excreted? That shows you that they're not valid. Here's a result of testing for 14 mycotoxins in the blood. And on the left is the IgG antibodies, on the right is the IgE antibodies. I'm going to explain that in a minute. Here's after treatment. So before, after. There's still some left on the right side, but that'll go down in a while. Same here, before and after. People who do stool tests, they're only 26% specific. Don't use them. And don't use the OAT test, organic acid test. They don't measure what they claim to. Don't use urine testing. I'm a toxicologist and a clinical immunologist. In toxicology, we don't check urine unless it's an acute, something happened, you swallowed something at home, or the child found something under the kitchen sink and drank it. You rush to the emergency room, maybe urine, yes, but in normal circumstances, we don't use it. So always look for chemicals in the body, not coming out, what's left the body. These are tests that don't help, don't use them. And I go through each one of these. They're not validated tests. Don't use binders because they do not help. And here's a study showing they're ineffective in mycotoxins. And here's another study showing they're no good. There's no sufficient effect against mycotoxins. And then there's too many supplements. People who come see me, they've taken 20, 30, 40 supplements of all kinds. That's way too much. The maximum I use is 8. And this is all published. And mycotoxins can cause mast cell activation syndrome. A group of doctors and I published a study April of 2024 on this. And remember, if you have the wrong diagnosis and the wrong treatment, the patient continues sick and gets more sensitive. If you have the right diagnosis and the right treatment, the patient gets well in about 6 months. That is the treatment for molds and mycotoxins. Here's the bad news about mycotoxins is they took 60 supplements to the laboratory to check what's on the label, if that's really inside the bottle. And 11% had in the bottle what was it on the label. 40% had nothing in the bottle that it said on the label. The other bad news is that in 93% of these, of 40 supplements, they found traces of lead, arsenic, mercury, cadmium, or pesticides. And lastly, on botanical supplements, they contained plant species that were not listed on the label, and there was active ingredient substitution at 83%. So what I've done in the last 25 years is I send supplements to be tested by a company. When they come back and they say it's 100% pure, then I recommend them to patients. And I have that list. Treatment, fluconazole. Fluconazole has limited spectrum of activity. It is not active against Aspergillus and several species of Candida. Compared to itraconazole, these are both antifungals. Really, fluconazole is only for Candida, although in some Candida that's not effective at all. Whereas itraconazole is effective in all of them. And the dose is 100 milligrams twice a day. You take it with food for better absorption. The treatment for the chronic sinusitis is this amphotericin B nasal spray. It's at a 0.03% solution plus itraconazole, 100 milligrams twice a day with food. Here's a study published. Itraconazole oral solution and intravenous formulation. They reviewed this and said that it has broad spectrum activity. It's well tolerated. It's highly efficacious. It produces consistent plasma concentrations, ideal for the treatment of fungal infections, and specifically can be tailored for use in all patients, including children and those who require intensive care. Here's another one on safety. Itraconazole, also known as Sporanox, is a common antifungal. It was developed in the 1980s and has an established safety records. Standard dose, 100 milligrams twice a day, 6 months, if you've tested positive for the antibodies. This is the dose from start to finish. Don't use the pulse method. That's only for toenail fungus called onychomycosis. Here's another one that says how safe it is. It's a broad spectrum. It can be used orally and intravenously. And itraconazole has been well tolerated with doses up to 400 milligrams a day, free of serious adverse side effects. So this treatment consists of 4 parts. One is get the patient away from the toxin or the toxin away from the patient. That's the first rule of toxicology. And then 100 milligrams of itraconazole, 8 specific supplements and vitamins at specific doses. I can send that to you. And low histamine, anti-inflammatory nutritional diet. And this is a clinician said that he was blown away by all this information when I gave it at a medical conference. And this is a healthcare provider who tried the holistic route, with just herbs and supplements, and it does not work. Here's a young woman before and after. So you can see just in her smile that she's much better. This is called SIBO. And you can see on the left and on the right, 3 months, June 10 to September 12 on itraconazole. This is mast cell activation on a woman. This is her back and this is the leg, and after treatment. And they're saying here, don't use the ERMI test. And this was published August 22 of 2013. And I'm inviting all of you, if you want to submit a paper or study. I'm the guest editor of a special issue of pathogens called Invisible Enemy, Fungal Toxins, Mycotoxins, the great masqueraders of the century. That is the end of my presentation. These are some studies. I have over 100, but these are 4 that you may want to look at. You're welcome to email me. My email is up at the top, immunedoctor@gmail.com. And that's it.
Well, Thank you very much, Doctor, for sharing this very valuable presentation.
Very
And
much. And it's really a worldwide problem because today what we use to build is not like how we used to build before. I mean, if you want to look at just something simple as the um, pyramids, how old are they? They're still there. Most of the buildings we have here in America, they're never going to last not even 10% that long because they're not built well. We don't use stone anymore to build. We use wood and things like this. So, and concrete and cement and things like that. We don't use. So all these things contribute to the problem of molds in our modern construction methods. And when can they start? As I showed in this presentation, they can start in the fetus throughout old age. The wonderful news is it can be treated. That's very important. Um, uh, I and two other doctors will be giving a course in a couple of months. If anybody is interested in taking the course, it's A to Z. So when you finish, you're certified. And if they're all they have to do is email me, and I'll put them on the list. And then when the course starts, I'm here. I'm not young anymore, so I'm trying to teach as many young people like you, so you can help other people.
Yeah, thank you very much for that. And your lectures are online as well, and they're very helpful. They helped me personally as well. I wanted to ask you about the diagnosis. So there is the test of the IgG and IgE, and you say that these are the best tests. And
Let's talk about that. In microbiology, we know that IgG indicates a previous infection by a bacteria, a virus, whatever. Why? Because bacteria, viruses, and all those things are living organisms with cell walls, etc. Toxins are not alive. They don't have cell walls. They're molecules. The immune reaction to something living, IgG, indicates past. And for molecules, it indicates current, today. So when you have elevated levels of IgG, this is how much of each one, it's a quantitative test, how much of each one you have in your body right now causing a toxic reaction. IgE, normally we relate that to allergies, where mast cells produce histamine, heparin, and various other substances. Those are all to things such as pollen, cat hair, and various other biologic substances. We now have a toxin that's a molecule. When that antibody hits the mast cell, that mast cell will produce histamine, heparin, but will also produce what we call pro-inflammatory cytokines. In other words, it's going to send out a message to the immune system saying cause inflammation. And where is that inflammation going to happen? It's going to happen in basically three places: the gut, the gastrointestinal system, the brain, and third, lastly, the skin, especially with eczema.
mm-hmm.
So the key is don't treat it with the eczema with creams. Don't treat this, don't treat that. Get rid of the mold where it is, then get rid of the spores by taking itraconazole that carry the mycotoxin. We're not trying to kill the mycotoxins, you can't. You kill the spore that carries the mycotoxin. When you kill the spore, there's no more mycotoxin.
The IgG and the IgE, to your knowledge, are they available in the United Arab Emirates? I searched for it here and I didn't find any of the labs. They're doing the incorrect ones, which you mentioned, unfortunately.
So yes, what you do is you got to order the test. You do the test. Anyone who orders that test can have a complimentary consultation with me. I helped develop it. It's not my lab. I don't have anything to do with it, but to help them Well, mainly to help people all over the world.
It
I want to
delivers
make
all over
sure
the
that
world. Tell us the steps.
or mycolab.com,
I see.
and they take care of it. And also, when if you you know it's you have a complimentary free Zoom call with me, we can go over. You can tell me about what is wrong with the person, what they have, and I can help with all of that. The other part is then you repeat it in 6 months,
Hmm.
not before, because the immune system is vast and it's not a month or 2 months or so forth. It's like asking a great big whatever to turn around quickly. It's not going to happen.
Talked about chronic sinusitis. How do we determine if chronic sinusitis is related to mold complication, or is it related to structural nose problem, air pollution, trauma? How do we differentiate?
Yeah. I mean, air pollution and all these things exist all over the planet.
Yes.
Um, However, chronic sinusitis, the easiest number one is the person comes in, I'm always congested.
Mm.
I'm always blowing my nose day and night, etc. So one thing a person can do is a doctor can order a CT scan, and the radiologist will read thickening and so on and so forth of the sinuses, etc. And usually they will recommend an ear, nose, and throat to take that away. It's not necessary to do that because all you need is the amphotericin B and the itraconazole, and that person is fine. Actually, they're fine usually within 3 to 4 months. They'll slowly improve. Many of them have anosmia, which means they can't smell very well
Yeah.
because of this congestion. Also, about air pollution. Air pollution affects lungs more than sinuses.
Yeah.
Patients with air pollution will have more shortness of breath, chronic light cough, like that, than big heavy cough. And so, chronic sinusitis, the patient will tell you, I was fine until I moved into this to here or to here, and then it started. Air pollution is from childhood on where you live.
How do you diagnose that there is mold growth in the breast implants itself and not from the other source like the environment? Is there a way to test for mold in the breast implants?
Well, because usually they will identify they were fine before the breast implants and then they started getting sick. Be a good doctor, you have to be a good diagnostician, and you have to be a bit of a Sherlock Holmes. A few months ago was the World Symposium on breast implants with doctors from all over the world, including me, because I've published 23 papers on breast implants, 23 studies. So it was clearly shown that this is not a problem just in one country. It's in many, many countries, number one. Number two, all the studies are well done, well, and show problems. Yes, explantation is probably the number one thing that will help but not cure. Why? Because if you get explanted, you take care of the main cause. Remember, find the cause, remove the cause, repair the damage. But once you've done that, you've removed the cause, you've got to treat the repair the damage. And the damages, you do the MyMycoLab blood test, and once you've done the blood test, you have the results, you can talk to me, or you can try yourself, however you want. But there's these steps you take, and then after a few months, the patient is well.
Could you talk to us about neuroimaging role in mold growth, especially to the brain?
Depending on what you want. In other words, in ASD, autism spectrum disorder, you want something like a SPECT, single photon emission computerized tomography, a SPECT scan,
Mhm.
because that tells you the functioning in multicolor of the brain, multidimension. In children with autism, they'll have some IgG, but a lot of IgE. And it's amazing to watch them get well because the parents are so happy. Number one, of course, Papa and Mama, my son, my daughter, that's natural. And the other part is that they are aware of this. I saw a patient last month. This is a 9-year-old girl who is now fine. She came to see me in September of last year. She's now fine. And she asked me, will I ever go back to the way I was? So they know
Yes.
when they're having it. And they realize I don't want to be like that anymore. And they're usually very smart children, very talented. SPECT is the best. For if you suspect demyelination, it's MRI. Because what they'll do is in T2 flares, there'll be little white spots on the MRI, and that's demyelination. Then you treat the patient, and then 6 months later you repeat it, and there's no white spots anymore. And again, I wrote a textbook chapter with several other authors on this. It's we showed how to do that, how to diagnose it, and how to treat it. The chairman of the Department of Psychiatry of a major medical school, all his patients that don't respond to anti-anxiolytic medication or psychiatric medication, he does this test, treats them, and then they don't have that anymore. Again, it goes to the brain first. Anxiety, depression, sleep disturbance, brain fog, balance issues, short-term memory loss. All these are the effects of toxic molds and their mycotoxins.
Can someone develop antifungal resistant the same way that someone would develop antibiotic resistant for itraconazole?
In all the years I've been doing this and using itraconazole, more than almost 20,000 patients, more or less, I've had two problems with itraconazole, two patients. One was a 43-year-old female, and she developed total insomnia. So I changed her from itraconazole to voriconazole, and she was fine. The other one was a 53-year-old man, and he developed dyspepsia. I changed him, and he's fine. This is in almost 20,000 patients, 35 years. Two times I had issues. This discussion we've had today is a general one. Because remember, every human being is unique and different. Everybody's immune system is unique and different, like a fingerprint.
Yes.
So this is general information. More specific information would take me obviously longer to go through many variations, which is why we're developing this course. But the point is that let me give you some pointers. For example, if the person is still being exposed to toxic moles and you start treatment, they'll feel worse. That's a way you can find out, oh, there's still mold somewhere where you live or where you work or where you go to on a regular. It could, today there's many places you can pick up. You go to the same friend's house every day or every 2 days, and he has mold maybe. It's not in your house. There's a lot of different variations, and I can't get through all those variations in the short time we have. However, usually doctors, we've all been kind of trained to understand that it's not the same for everybody. It's not your shoes don't fit me and my shoes don't fit you, So you have to use a lot of common sense and think things through. But the treatment that it's not, I didn't develop it. It's this medical center developed part of it, this other medical center, and I get it from all over the planet. I'm the editor-in-chief for 5 medical journals, so I read a lot of material every day. So I see what's happening in many, many different countries, every country. The only country I don't see studies from is North Korea. That's it. Every other country you can imagine. So there's a lot of discussion about molds and mycotoxins,
Yes.
more than there was, say, 10 years ago. And I think that this program of yours is excellent because it's helping others in countries that may not know these things or may not understand these things, and now they understand it. Plus, they can send me an email. I'll be happy to explain things to them in writing, send them studies that they can read, et cetera, et cetera.
Yes, thank you. And we're happy to share your teachings. Why is the treatment protocol very long? Why does it take so much time, 6 months, to get rid of the mycotoxin completely?
Okay, let me address that. How long does it take to treat a bronchopneumonia, which untreated results in death? A week, 10 days, 2 weeks, the longest.
Yeah.
Why? Because you have an antibiotic you can give, right?
Yes.
What antitoxins are there for mercury, which is very common and has been known for centuries? There is none. There is no medication for toxins. So they have to be removed by a different method, and they're molecules. So they go all over the body. They get in and out of tissues, in and out of cells. So we have the body. Then you have organs like the brain, the lungs, the liver, etc. Then you have the different cells: brain cells, lung cells, bone cells, muscle cells, and then you have the cellular level, which inside the cells is the nucleus. There's the mitochondria, etc. And lastly, there's the molecular level. And that's what you're talking about here. It's the molecular level. So it's not like an infection. It's not an infection. It's a toxin. Same thing with mercury. What's the treatment for mercury? Minimum, if you catch it early, 18 months to 24 months of chelation. So toxins are not easy to deal with.
Yes, and one of the slides that you have shared with us that I believe it was 89% of the supplements does not contain the supplements that are advertised or contain some heavy metals. How do we deal with that? How do we protect ourselves from all of these metals, and how do we reduce the chances of getting supplement that will harm us rather than help us?
I've already done that for you. I know which company makes the right kind and which company I wouldn't use. I wouldn't give it to a dog. So if you use the right kind and you've done the studies, again, look at the color of my hair. I've been doing this many years. So I've tried everything, especially in the beginning when I was younger. There was nothing on this before. This is why I published studies, because I want other doctors to know as much of this as they can. For the supplements, just write me. There's a company that makes them. I found the company and I said, okay, I'm going to test your supplements. If they're okay, I'll recommend it. It's called detoxpure.com. I had them checked for one, all heavy metals, cadmium, arsenic, lead, mercury, etc. I also checked them for pesticides. I also checked them for insect parts. You don't know in the factory there's a cockroach or some animal, spider or something.
Yes.
And lastly, for rodent droppings. I don't know, maybe there's a mouse, he makes poo and it rolls into the vat or something. I don't want any of that in my patients.
Yes, of course.
They tested 100% pure in every one of their products by a different laboratory, not them. I had it done by a different laboratory. I sent it somewhere else.
Yeah, third party.
One more thing. Patients should be on an anti-inflammatory diet. Now, in general, if you would ask me, since I was born and raised in the Middle East, Middle Eastern food is wonderful. That is an anti-inflammatory diet. Western food, no. In trying to simplify it for everybody, it's 4 steps. One, and the hardest part, as I've mentioned several times, is get the patient away from the toxin or the toxin away from the patient. And this is after you do the test. Number 2, itraconazole. Number 3, 8 specific supplements at 8 specific doses that have been shown in many, many studies to help the patient heal from toxins. Last, anti-inflammatory diet. Eat only Arabic food.
What other sources do we get exposed to heavy metals other than supplement? What should we be aware of?
The first rule of toxicology is get the patient away from the toxin or the toxin away from the patient. But in the case of molds, mycotoxins, the spores, it's very difficult. It's much more easier. Say you work in a laboratory, and this laboratory is using sometimes mercury. Well, you quit the laboratory and go work somewhere else. But what if this is in your home? What if economically this is not a time where you can say, okay, I'm selling this and moving, or I'm going to stop renting and moving, and you can't because you have a contract. So it's not easy. It's complex.
Yes.
And by the way, I have about 40 videos on YouTube going over all these things. What is the number one source of heavy metals? Raw seafood.
Mhm.
Sushi, sashimi, raw tuna, which are all very popular today.
Yes.
So, for example, what happens, let's change from that to parasites. Where do you get parasites from? Raw meats. Why is it not good to eat pork? Why? Because if you eat raw pork, there's cysticercosis. It's a parasite. The larvae are in the meat. And even though you cook it, it still stays. So we need to avoid eating things raw and eat them like your great-grandfather and great-grandmother did, because they were smart. They cooked things. And everything was fresh. They didn't have refrigerators.
Do you recommend omega-3?
The problem is omega-3s are made from the liver of fish.
Mhm.
These big fish, like tuna, for example, they're great big. They eat smaller fish. Those smaller fish eat smaller fish. Those smaller fish eat smaller fish. Okay? So this is a chain. The biggest fish end up with the most mercury. Now, if you're eating sardines or anchovies, they're very small, so they don't eat smaller fish. They're safe. The omega-3s, the problem is that they come from the liver, and you don't know what kind of fish in this factory. So they may have contaminated by heavy metals, mercury in particular. And in the oceans, it's not mercury, it's methyl mercury, which is the most toxic form of mercury.
Worse form.
Industries, these ships that have fishing, this huge industry of fishing, etc. They get them from runoff because people spray things on the land and it rains, it goes down to rivers, the rivers go into the oceans, etc. The oceans are polluted.
Yes.
I mean, somewhere in the Pacific, there's I don't know how many square miles of this island floating, and it's all plastic. It's just plastic.
What about omega-3s from squid?
Well, again, uh, in toxicology, unfortunately, the planet is getting more and more toxic. Right? We're not taking very good care of the planet, and and I mean, think you wash your clothes in phosphates because the soaps for clothing is made with phosphates, and then you wear it next to your body, and then you have sweat glands in your body, and you absorb it. But fortunately, we have a very good immune system which gets rid of these things because God made the immune system. And anything he makes is pretty good. So there's a lot of different aspects. If you like, I can talk about toxicology at one time.
So many things to follow up. We would love to have you back here sometimes in the future.
Yes, I'll be happy to come back.
Yeah, very good. Very good. Well, thank you very much for sharing the presentation and for sharing your knowledge and
Welcome.
wisdom.
Thank you.
Yes, and it was a pleasure to have you with us.
Thank you. Shukran, Habibi.
Shukran. Shukran. Okay, take care, doctor. Thank you very much. Thank you.
You're very welcome. Have a wonderful
You too.
rest of your week.
Thank you.
Thank you.